My name's Julie. I'm a
I'm
nurse
Stephanie.
working with you today. Okay, nice to meet you. What brings you here today, Steph?
Just a regular physical.
All right. So you want to just get checked out and see what's going on?
Yes, ma'am.
Wonderful. All right, so that's going to be pretty extensive, okay? So generally what we do is we just work from head to toe, and I'll be touching you all over, asking you some questions. If there's anything bothering you at that time, go ahead and let me know, okay? So that way I can figure out, we can maybe figure out what's going on with you today, okay?
Yes, ma'am.
All right. So are you having any discomforts, any issues at all?
No, ma'am.
Okay. All right. So what we're going to do is we're going to work your head to toe. So we're going to work head, face area first, and then we'll just work our way down. Okay? All right. So are you in school, Steph?
I am.
All right. Where do you go to school?
I go to Leeds High School.
Okay.
I'm a senior.
All right. Congratulations. I know
Thank
you're
you.
excited.
Yes,
Super
ma'am.
excited. Okay. All right. Any problems with hearing at all?
No, ma'am.
Okay. I'm going to whisper something to you, and I want you to repeat it back to me.
Okay. Class of 2020.
All right, good deal. All right. Have you had any discomfort in the sinus area region?
No, ma'am.
Okay, no sniffles, coughs,
No, ma'am.
anything like that? Is that painful
No,
to
ma'am.
touch? Okay. All right. Your skin looks really clear.
Thank you.
I know a lot of times we see some kids as they come in with some acne, but your skin looks really clear. Do you have a skincare regimen that you use?
Just wash and moisturize.
Okay. I see you got nice, pretty long eyelashes.
Thank you.
Your eyelids are all nice and pink. Okay. Have you had any draining from the eyes or anything at all?
No, ma'am.
Okay. Can you blink for me? Blink real hard. Okay. Perfect. Perfect. All right. Let me take a peek at your nose, baby. Okay. You breathing okay? Any difficulty breathing in the nose at all?
No.
No runny nose, sinus problems, nothing like that? Perfect. 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 What about your ears?
Perfect.
No pain below your ears or anything like that at all?
No.
Okay. I want you to open up big for me. As big as you can. Okay. Now say I. Perfect. I'm just going to take a peek around. Lean your head down for me. Okay. You got nice straight teeth. Do you have braces or are you just lucky?
I have braces.
Braces. All right. Everything's nice and pink in here. All right. So I'm going to kind of go to the back of your throat a little bit, and it's going to make you feel like you got a gag, hopefully. Okay. That's totally normal. Open up for me. Okay. And there you go. Perfect. You all right? You okay? I know that's kind of uncomfortable to say the least, but looks good. Can you puff out your cheeks real big for me? Okay. Perfect. All right. So I want you to tell me if this feels dull or sharp.
Dull.
Okay. What about here?
Sharp.
Perfect. Okay. Do you feel that?
Mm-hmm.
Feel
Yes.
that? Perfect. What's it feel like to you?
It's like something rubbing across your face.
Just tickly and light. What'd you have for lunch today?
I had some Jacks.
Was it good?
Yes.
All right. So no problems with sensation of taste, nothing that's bitter, sour all the time,
No.
or having difficulties tasting or smelling?
No.
Okay, perfect. What does that smell like?
Lotion.
Like hand sanitizer lotion? Perfect, perfect, perfect. All right. All right. Now, I'm going to ask you to open up wide for me and close back. Open up wide, close back. I don't feel any crepiness or creepiness going on. Do you feel any popping, or does your jaw ever get locked up on you at all?
No.
Okay, perfect, 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 perfect. All right, let's see. You have nice brows. You do your own brows?
I do.
Girl, I'm an 80s, 90s kid, so I plucked mine a little too much, so I have to draw mine on every day. All right, let's see. All right, so I'm going to ask you, I've got a pen light right here. So I'm going to ask you to follow my fingers, okay? So I just need you to follow directions the best you can for me. I'm just looking at your pupillary responses and make sure everything's well, okay? All right. Nope, look straight at me. Look right here at my nose, I'm sorry. Look right at my nose. Perfect. Good deal. Okay, just look straight at my nose right here. Okay, lights in the same place. Do me a favor, cover your left eye for me, okay? And uncover your left eye for me. Okay, cover your right eye. Uncover it. Good deal. We're just making sure they're not going opposite directions. All right, I'm going to ask you to look at my finger right here, and I want you to follow my finger all the way out. Good deal. Perfect. And I want you to follow my light here, okay? Good deal. Look at you go. Okay, perfect. So all of your cranial nerves look like they're doing okay. So I want you to lift my hands. Try to lift my shoulders up. Shrug your shoulders real big, real big, real big. Okay, perfect. Good deal. All right. Stick your tongue out for me. Move it left. Left, right. So move it right, up, down. Good deal. Perfect. All right. Let me see. You ever had any damage to your nose? Broken? Been hit with balls? Anything like that?
A couple years ago, I got my veins in my nose burnt.
Cauterized? Were you having nosebleeds?
Yes.
Okay. Did they tell you why you were having nosebleeds?
No, it was just dust and allergies.
Okay, yeah. Sometimes there's a really thin membrane that sits that covers our nose, and we have blood vessels that sit right below that. So sometimes with any inflammation or irritation, especially with seasonal allergies, anything like that, they get hit wrong way, and those blood vessels can burst a little bit and ooze. So
always in the summer.
Oh yeah, so always dry heat.
Dust.
Perfect, perfect. So have you had any problems with it since then? Okay, good deal. All right. Okay, say ah for me. Okay. Swallow. Okay. Swallow again. Good deal. Lean your head back for me. Anything nice and straight. Swallow for me. Good deal. All right. I'm just going to take a listen real quick, okay?
Okay.
Just listening for blood flow. Just making sure we hear a nice little whoosh sound. Okay? All right. All right. I'm going to lean you back a little bit, okay? I just want to look and see what your veins are doing. All right. Hold my hands. Okay. And I'll bring you right back here. All right. Just lay your head flat for me. Pulses are all normal. Hands. Up we go. You're welcome. Okay. We're just looking to make sure you don't have any what we call JVD or jugular vein distension. Sometimes that can be indicators of heart issues or problems, but everything looks completely normal there, okay?
Okay.
All right. All right, so I'm just going to take my hands up and down your neck, okay? I'm just looking for lymph nodes. Lymph nodes are a really awesome part of our body and system. So they're what we call filters. So they filter any lymph fluid out of our body. And anytime we may be sick, it kind of helps filter that out and it catches them. So have you ever been sick and then they get swollen and they hurt? Don't people look at us hurt, don't they? Well, they're really an amazing part. Have you been sick?
No, I had the flu.
When did you have the flu last?
So last year in April, I want to say.
Okay. Okay. But nothing recently?
No.
Okay. Have you had a cough or anything recently?
No.
These are a little puffy, but nothing big. Are they painful to touch?
No.
Okay. Good deal. So you got them everywhere, all over your body, from that literally the back of your neck to your toes, and down towards your ankles.
Wow.
Yep. Well, the whole body. Think about how big the body is and what we got to have.
Yeah.
Okay. Good deal. Okay. All right. Your skin looks nice and clear and soft. I don't see any. Do you have any like moles or anything like that on your body that you've been concerned about that you want me to look at? Just occasional few freckles here. I see. Oh, yeah, goosies. I'm sorry. Okay. All right. Looking at your blood flow here. Perfect. So we're just looking for the blanching as the blood returns to the fingers. It tells us you got good blood flow. I'm just going to take a second and feel your pulses here. We know that heart's still going. Relax your arm for me here, baby. Okay. Perfect. Normal, normal. Okay. All right. So, arms out. Okay. Bend your wrist for me. All the way back. I mean, excuse me, your elbows. My bad. Hands above your head. Okay. Can you put them in circular motion for me? Like you swimming, 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 swimming. Okay. Now, hands straight out. Turn them over. Okay. Wrist up. Wrist down. Curl your fingers. Move your thumbs. Okay. No pain or anything in any of those joints. Okay. Doesn't look like any joint swelling or anything like that. Okay. Are you an athlete? Have you ever had any injuries to your joints?
I did have a knee surgery in 2015.
Okay. Surgery for what?
Kneecap displacement surgery.
Ouch! 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 Have you had any problems with it since?
Just the weather.
When it's
Cold
outside,
yeah.
Relax your leg for me. Just completely relax. Is this one the one you had surgery on?
No, it's the left.
Okay. Completely relax. Completely relax, like you have no. Okay. You don't have a whole lot of movement in your kneecaps anyway.
Dug a hole and replaced it. I don't really know.
Gotcha. Gotcha. Alrighty. Alright. So I'm just going to take a second and listen to your lungs, okay? Have you had any difficulty breathing?
No.
No coughing, nothing like that? No pain when you breathe in or breathe out? Okay. Nothing abnormal or unusual. Okay. Do you have asthma? Ever been diagnosed with any respiratory disease or processes? Okay.
No.
Take a big deep breath in for me. And blow it out quick. Okay. Again. Blow it out quick. Perfect. All right, I'm going to take a listen back here, okay? Okay. Big deep breath in. Out. In. Out. In. Out. In. Out. Again. Out. Again. In. One more time. Perfect. One more time. Again. Good deal. Okay. All right. I'm going to ask you to repeat 99, okay? And when I say again, just keep repeating it till I say stop. Say it for me.
99.
Again.
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 99.
Okay. Perfect. Okay. Alright, slightly turn this way for me a little bit. You're just going to feel my hands just kind of wrap around your back. Take a big deep breath in for me. And blow it out. One more time. Blow it in. Out. Perfect. We're just looking for equal expansion there. Put your hands over your head for me. Just want to take a look at your diameter here. Okay. No discomfort, any swelling or anything. I'm sorry. I know I'm touching your armpit. Okay. Just going to feel up under here. Okay. All right. I don't feel. I was just feeling for lymph nodes. You got lymph nodes up under your armpits as well. So turn back around this way for me, sweetheart. So we just want to make sure that you don't have any swelling going on there. Okay. Now it's not unusual sometimes that you do get some swelling up under there. Do you do yearly breast or monthly breast exams?
I do.
Okay. So sometimes, especially when our hormones with periods and stuff, do you have cycles regularly every month?
Yes, I do.
Okay. When was your last cycle?
March the 2nd to the 6th.
Okay.
I mean, February the 2nd.
February. I was going to say March is next month, dear. No problem. No problem. So you have, what is your normal period length usually?
It's about 5 days to 6 days.
Okay. Light, heavy.
The first 2 days are really heavy, and then the rest is
This is normal. Okay. So sometimes I tell women stay away from breast exam during their cycles because the hormones will cause our breast tissue to be kind of nodular, and they can be tender and sort of the touch. And then oftentimes we even have breast tissue that goes up into our armpit.
Yeah.
So that can also be swollen and nodular. So what we don't want to do is have a patient mistake what may be tumor or what they think may be tumor, which may just be swollen glandular tissue.
Okay.
So I would tell you stay away from your cycle time to do your breast exams. So maybe the week after your cycle would be good, okay? But don't be alarmed if you are doing it towards your cycle and you do feel any discomfort. One thing that we really look for, and oftentimes when we're swollen like that, it's uncomfortable. Have you ever noticed that?
Yeah.
That you have some, do you have any, ever noticed any nodules or anything like that?
I did kind of. It's kind of on the way now, but I felt like they're really tender, but I haven't started my cycle or.
Is that around your cycle time, like a week before?
It was after, so.
Okay. Has anyone in your family ever been diagnosed with breast cancer?
Yes.
Okay, so that's a scare that you have, okay? What I do say is, I know you're young right now, but we do ideally recommend mammograms at least 35 years of age. Do you have a regular gynecologist that you see?
No.
Okay, I would recommend, especially when you're sexually active, that you definitely do that. And let them look at your history and determine what testing, if any, they want to do. But definitely you're under the care of a primary physician or a GYN physician that can look at that regularly. Sometimes they do recommend that you do that sometimes even earlier, starting at around 30, and in some extreme cases even before that. But definitely something that you want to keep a look at and definitely do monthly breast exams.
Okay.
Anybody in your family ever been diagnosed with fibrocystic breast disease?
No.
Okay. Sometimes we do see, especially in younger women and younger population, we do see that a large amount of caffeine intake will make the tissues kind of cystic-like and make them a little hard, but like nodular feeling and tender to the touch. So, limit your not alcohol intake, limit your caffeine intake, and if that's bothersome to you, you definitely want to get to a physician, okay? Not that you can't ever have caffeine, we just don't want you to have a huge amount of it, okay? All right. All right. All right. Do you have any pain upon palpation here?
No.
Okay. Perfect. Okay. So I'm going to listen also to your heart. I just want to kind of hear what's going on. Have you ever been diagnosed with any problems or issues with your heart?
Yeah.
Never had any feeling like your heart's run away with you, any type of palpitations or anything of that nature? What about like climbing stairs, anything like that? Shortness of breath?
Other than being out of shape, then I'm perfect.
Yeah, now that can be a culprit for sure. Okay. Okay, I'm just going to come right up under the breastbone right here, okay? Okay, perfect. Everything sounds normal there.
Okay.
Okay. All right. Say 99 for me.
99.
Again?
99.
Again?
99.
Okay. Arms up a little bit. 99.
99. 99.
Okay. All right. So what we're going to do now is we're going to do a breast exam, okay? So I'm going to work on one side and on the other side. What I want you to do is lay back for me. Okay, come back. All right. Now take this arm and put it up behind your head here, okay? All right. So generally, how were you taught to do a breast exam?
Just go from outer to inner.
Outer, yeah.
The circle.
Circle, yes, absolutely. So what we want to do is we want to sweep first. We just kind of want to sweep along the tops and sweep along the bottom, and then work from the inside, from like your middle of your chest in and outside of your chest in. Okay, so we just want to sweep. We really literally just take our hands and kind of sweep them along there. Okay, because oftentimes just a light sweep will help us pick up something, because we do have our breast tissue is all nodular oftentimes around there, and can be, like I said, especially during cycle time. So the sweeping kind of helps a bigger lump just kind of jump out at us. Okay, and then we want to take from the outside and feel around, and we still want to be kind of sweeping in an upward motion, just kind of small. So we want to do the big sweep, okay, all the way around, and then we want to do small sweeps all the way around inward. Okay, one thing that I want to remind you of, don't forget the nipple area. Okay, because we can have to, if there is lump, there could be a lump behind the nipple area itself. Okay, all right, I'm gonna come around the other side. You can put that arm down, sweetheart. Okay, so yep, put this one behind your head there for me too. Okay, so we're just sweeping along. Okay, we're on the top, along the bottom. And most of our breast tissue, our glandular tissue, sits towards the bottom of the breast, which is important that we really look there. Okay. Okay. All right. You have your hands. Everything feels normal there. No problems that I see. Okay. But also, like I said, you always want to kind of take, once you work your way into the breast, you always want to work around the nipple and actually depress the nipple itself in, okay? Because the way our breasts are made, there's all these milk sacs, and then they've got little, I call them like little highways, what we call them as ducts, that run down and run into the actual nipple complex. So there's not like glandular tissue behind that nipple. So it should depress in with no problem. You shouldn't have any densities or anything back behind there, okay? Okay. All right, my dear, I'm going to lay you back down, and I'm just going to palpate around on your abdomen, okay? It'll feel a little bit odd because I'll do some light palpation, and then I'll take my hand up behind your backside, and I'll just kind of deeply palpate. If at any time you're uncomfortable, make sure you let me know, okay? All right, I'm going to take a listen to your bowel sounds. How about your stomach? Any problems or issues with your tummy at all? Okay. Just going to pull this down up just a little bit, okay? So no discomfort noted at all?
No.
Bowel movements are regular?
Yep.
Okay. Okay. No diarrhea or constipation issues that you've had? How do you eat? What kind of foods do you eat?
Just normal, I guess.
You eat like a normal teenager?
Yeah.
Okay. Do you like to try to eat fresh foods, or do you find yourself eating a lot of fast foods?
More fresh.
Fresh foods, good. Okay. Your tummy's working today, that's for sure. Definitely. Okay, sounds good. Sometimes we have to wait a little longer to feel what we want to, or hear what we want to feel. Okay, this is where it may be uncomfortable to you, sweetheart. Okay. All right, nothing unusual there. I'm just going to see if I can determine where the borders of your liver are. We just want to make sure all that's normal. Okay. I know, sorry, I know that tickles. Okay. We're here to here, so it's very normal. Okay. Very, very normal. Okay. Anybody in your family ever been diagnosed with ulcerative colitis, Crohn's disease, anything of that nature?
No.
Okay. Alrighty. Alright. Now I do want to take a feel of your, one more time. I need to come on back for me. I got you. Got you. Alright. I'm just going to feel your femoral arteries right here. Just feel your blood flow. So you got this big aorta that runs down through here, and then we have femoral arteries that kind of branch off from it and supply all our lower extremities. Yours are good. They're very good. Now just relax for me. We got them behind our knee right here. And then we got them behind our ankle bone right here. They're really easy to feel on nice, healthy young ladies like you.
Thank you.
Yeah. Sometimes our older patients, maybe with some heart disease issues going on, they're a little harder to feel sometimes. Okay. It all feels great. Okay, so now what we're going to do is all the fun stuff, okay? So I want you to do me a favor, lift your hip up as high as you can bring it to you. High as you can, high as you can, high as you can, high as you can. Here we go. Okay. Any pain in that hip anywhere? Bring this leg towards me. Okay. No popping going on there, that's good. Just wait till you get older. Okay, up, 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 up. Bring it to me. And rotate it back around. Okay, good deal. All right, my dear. So, feel something. Feel that?
Mm-hmm.
That's your aorta. It's about that big around. It's applying all that fluid to your body.
Yeah.
Okay. All right. Now, let's lift up for me. Oh, perfect. All that feels normal. All right, sweet girl. So I want you to stand for me. Can you stand up for me? Okay. So I want you to hop on one foot for me. Okay. Swap. You swapped quick, didn't you? Okay. So now I want you to turn for me, and I want you to walk three paces this way. 1, 2, 3. Turn and walk back, heel to toe. Heel down first, and then do your toe. You okay?
Yeah.
Okay. Okay. All right. Perfect. All right. So close your eyes for me and stand on one foot. Okay. Close your eyes to continue closed and stand on the other foot. Okay. Okay. All right. Good deal. All right. Turn for me here. Lift your arms up over your head for me. Okay. Back down. All right. Now I want you to bend over and touch your toes. Okay. Any pain in the hip area?
Yeah.
I'm just going to run my fingers down your spine, sweetheart. Just making sure everything's where it should be, okay? Okay, stand up for me. Okay. Now I want you to turn. Keeping your hips right, stationary. Okay, again. Any pain? Popping, discomfort there? I don't hear any popping. Okay. All right, relax for me. All right. Now, try to move your shoulders away from my hands. Good deal. Perfect. All right. Stand back towards the table for me.
Behind the table?
Nope, right here, just right in front of the table. Okay, hold your arms out for me. Okay, I'm going to try to push my hands to you. I want you to try to push my hands away. Okay, as strong as you can, as strong as you can, as strong as you can. Perfect. Okay, lift your knee up for me. Try to push my hand away.
Ooh.
Push my hand away, push my hand away, push my hand away. Okay, again. Perfect. Hop up on the table for me. Hop up, hop up. Okay, push your feet up for me. Okay. Put your feet up here for me. All right. Try to push my hand away. Push my hand away. Push my hand away. Push my hand away. Good girl. Again, again, again. Perfect. Perfect. Okay. Push my hands away. Push my hands away. Okay. Good deal. No problems there. All right. All righty. Okay. All right, dear. Hold your hand out for me.
Which one?
Both of them. Okay. I'm going to write a letter in your hands. I want you to tell me what letter I'm writing, okay?
You want me to tell you?
Mm-hmm.
Okay.
So close your eyes.
A. H. H.
Close your eyes. Okay.
O.
Okay.
H. B.
Okay. All right. So let me see this hand one more time. All right. Close your eyes.
H.
Okay.
Wait. F.
Okay.
B.
Okay. I'm going to do a number. Tell me what number it is.
4.
Okay. I'm going to do a letter and tell me what letter it is.
S.
Okay. That's better. Better. Okay. So I want you to take your heel for me, and I want you to rub your heel across your shin bone. Okay. On the other side too. Perfect. All right. Okay, so I'm going to put my hand right here. I want you to take your finger and move it from your nose to my hand, as fast as you can, okay? Okay, turn your finger over.
This way?
Yep, and then flip it to me. So, over. Fast as you can. Okay, perfect. Good job. Okay. Alrighty, now I'm going to look at your reflexes, okay? Your reflexes oftentimes just tell us how that body is doing. So I want you to just relax. No. Relax. Just relax your arm. Completely relax it. Like it just has no control whatsoever. Relax it. I know that's hard to do. There we go. Okay, you see the other one? Relax. Alright, just keep your legs relaxed as possible. Look at there. Alright, relax as possible. Okay, good deal. Alright, relax as possible. Okay. Isn't that weird? That's the weirdest feeling, isn't it? Alright, sweet girl. So it looks like everything is normal to me, okay, as we would expect to see it. Do you have any questions about anything we went over today?
I don't. I think I'm all good.
Alright, well, it's good to see you today.
Good to see you
Thanks for
too.
coming to see us.
Thank you.